Assalamu alaikum. We will start our communication day. We have Mr. Nassim, 30. This is Nassim, 30 years, female, diagnosed SLE. The consultant decided to start steroids. Discuss with the patient father, Mr. Salim, about this. You are the doctor in the clinic. Sit with the father and address the concern. Okay, I will start the timer, then we can start the case. Practice. Ready both, Dr. Rada and Dr. Abdullah?
Yeah.
Yes.
Here you go.
Yes. Hello there. I'm
Hi.
Dr. Zin, one of the doctor in the joint clinic. Am I talking to Mr. Salim, the father of Mrs. Nasim, 30-year-old?
Yes, doctor. Yes, doctor. I am.
Yeah. And you are the next of kin of her.
Yes, doctor.
Yeah. It's nice to meet you.
You too.
Yeah. And I have taken the permission, by the way, from Mrs. Nasim to speak with you. Is that okay?
Yes, understood, doctor.
Yeah. So tell me, how far do you know about your daughter health condition?
My daughter, my poor daughter, is suffering too much from her joints and from her skin, and like all her body is in pain. She's suffering too much, doctor. This is like for the past 6 months.
I'm really sorry for that, Mr. Salem. And do you have any idea about her condition? Like, what is the diagnosis?
I have no idea.
You have no idea about what causing this condition.
No, at all.
All right. And do you have any kind of expectation that could be the cause?
I expect to listen from you that you may help me.
It's all right. Actually, thank you for sharing this information with me, as I imagine that your lovely daughter has been complaining of these joint pain, fatigue, and this is for the last 6 months, as you say. And a thorough kind of investigation has been done to Mrs. Nasim. And yeah, and actually, the results showed a condition, and I'm afraid that I'm taking and I'm coming with a bad news, Mr. Salim.
What bad news, doctor?
Actually, Mrs. Nasim has a condition called systemic lupus erythematosus.
Okay. What does that mean?
Have you had any idea about it?
No, at all.
Do you want me to explain?
Yes, please, doctor.
Yeah. Systemic lupus erythematosus, which is abbreviated as SLE, is a medical term for a medical condition in which there is a problem in our defense mechanism that mistakenly, instead of attacking, but it start to attack its own. In your lovely daughter condition, it start to attack her body. That is why she has like joint pain, being fatigue, she may have like rash, a problem with her hair. Are you with me?
Yes, I am, doctor. Go on.
Yeah, and it is a kind of a long-term condition. I'm afraid to tell you that it is not curable, but don't worry. It can be managed with a good follow-up and with our medication plan. Are you with me?
Yes, doctor.
Yeah. And before starting our telling you about our plan of management, it might lead especially if left untreated and without monitoring for a problem. For example, it may have like a problem in her brain, leading like to a mood problem. It may lead like to a kidney problem. It may affect her kidney. It may affect her lung. But don't worry. But don't worry. We are not gonna leave her like that. We will start her on a good management with our group of specialized team, including the joint, our joint consultant, specialized nurse, physiotherapist, dietitian, kidney doctor, lung doctor, and more. All of them will work for her to give her the best plan of management and regular follow-up. Are you with me?
That will
Yeah.
help her, doctor.
Yeah, I understand your concern. This will definitely help her. And this will bring me to that our joint consultant for her best interest decided a good drug that has been tried on many patients that will manage her symptoms, which is called steroid. Do you have any idea about it?
Yeah, no, I don't want steroid at all for my daughter.
May I know why?
I heard about this medication. It affects the sugar badly and the blood pressure.
I can really understand your worries about your lovely daughter. Any steroid is like any medication. First of all, I will let you to know how its mechanism. Do you know how steroid work?
No.
Yeah. Steroid work by it's actually they decrease the inflammation. I mean the soreness in the body. And this is exactly the way that we are gonna fight this SLE that I'm told you about the abbreviation. And it's like any medication. It has its benefit, will fight this inflammation and its side effect. And as you said, the side effect, it might increase the blood sugar, it might increase heart blood pressure, it might lead to increase in heart weight, like increasing in the body heat. But don't worry, we are not gonna give her this medication and leave her alone. No, we are gonna like put her under our eyes. We'll keep her under great follow-up. We will check frequently in the outpatient clinic her blood pressure, her sugar, her weight, everything we will do to catch them if this happen. And if any happens, we will treat it as proper as we can. Does that answer your concern?
Well, okay. What about if she is married? What about if she will get pregnant?
Mhm, mhm. First of all, is she pregnant or she is planning to be pregnant?
No, she is planning maybe later on.
Thank you for sharing this lovely information with me. Actually, like this disease, which is called the SLE, if left untreated, it might lead to many complications in her lung, in her kidney, and these in itself can affect badly her pregnancy. Besides, if we are going to start her on steroid, we are going to do a shared plan between us and the woman doctor to see how safe the steroid in her pregnancy and if she need like any dose modification in the future. Does that answer your concern?
2 minutes remaining.
Okay, that's nice. Okay.
Yeah.
Um,
Yeah.
okay.
Then I want to
So
tell you that.
is
Yeah, tell
my
me.
daughter gonna be all right on the long run, in the long term?
On the long term. What do you mean exactly by all right, Mr. Salim?
Is what about this? How we gonna how she will end up with her SLE, this disease?
I understand your worries. Actually, this kind of disease is a kind of long-term disease. I'm afraid to tell you that it is not curable. But
Okay.
with a good follow-up, good treatment, we will decrease any kind of like complication that might happen in the future. Does that answer your concern?
Okay. Yes, doctor.
Yeah. Do you have any other concern?
No, doctor.
And I want to tell you that she will start this kind of medication. She always like need to have a refill earlier. She doesn't need. She does. She don't. I am advising. I
Yeah.
advise her that she doesn't need to stop it like by herself because it might
Yeah.
lead to complication. I told her
Yeah.
about the red flag because if she stopped it by itself suddenly, it might lead to decrease
Yeah.
in her blood pressure, in her blood sugar. We will discuss this further with her.
Okay.
It might lead to decrease in her defense mechanism. That is why if she
Mm-hmm.
had like any kind of increased body temperature, any sore throat,
Mm-hmm.
anything, just to let us know. All right?
All right.
All right.
All right.
So, do you have any other concern?
No, thank you.
So time up to complete or not?
Yes, time is up. Yeah, 10 minutes, 25 seconds.
Yeah.
Anyway, you cover everything. So well done, Dr. Roda. Let's hear Dr. Abdullah comment, then I will comment.
Yeah, well done. There is also actually I have a comment about you said fatigue twice. It's fatigue is a jargon and uh, it's not mentioned in the scenario that she complains of fatigue.
All right.
So that's another issue that you suppose that she is complaining of that. But so is other good idea that you start by so you started good introduction, took permission twice. It's actually one time you to save your time. Like I took permission from your daughter to speak about with you about her condition, and that's enough. And then you confirm the agenda, and then expectation idea, and then you started explaining SLE well. But when you explain the symptoms, it's better you start by the symptoms overall. Like the SLE leads to joint pain, rash in the skin,
Agreed.
may lead to you will lead to body tired, feel tired so much. It will affect apart from the joint with internal organs so that he will understand later on the benefit of the steroid. So it will harm the kidneys, the heart, the lungs, if that is complicated. And then you go as your precious daughter is complaining since 6 months, long time, from her joints and skin. We don't want her to suffer. So you make him feel that this is so much important indication at the moment. We planned our consultant and our team to start the something called steroids, and here he will reject the idea, and then you start by the benefits of the steroid. And right now, be reassured, our plan is to start just to control this acute attack for a
Yeah.
shortest time possible for the lowest dose that is enough for her to make her out of the woods or like in the way of to control her symptoms. But as you know, it's very effective at the moment. It's very important. He will refuse again, and then if he refuses again, then you will say, okay, the SLE may lead to organ damage if we couldn't give these steroids, and they are quite important at the moment. If we don't give, okay, I will refuse. I and then you may involve the consultant if you'd like to discuss with my consultant. He would be in a better position. He will be able, maybe more because of his experience, to convince you of this. But usually in this case, they may not do that. I don't know. The side effect, you will explain more about the total side effect. You didn't explain the total side effect of the main important ones, because here you need to tell that we give supplements with the steroids. So to protect the stomach from the ulcers, we need, or soreness inside the tummy, because that's a side effect. We need to give her. You may expect that it may affect the mood. So he
Yeah.
is not surprised when his daughter gets in a mood fluctuation, mood swings.
Yeah.
And if that happen, we may involve the mood doctor, but we don't know. Hopefully not. We need to give bone supplements and calcium, because it reduces the bone density. And then you did very good. Okay, social support. Just go quickly about it because the time is narrow. We need to, if any issues about her job, how much, if this is very affecting her life and job, we may involve as a team the social worker and the occupational therapy specialist, and we may involve other parts as a team. We will work together, as you said. Yeah, very good. And you were empathetic. Yeah. Okay. Well done.
Yeah, thank you, Dr. Abdullah, for the case. Well done, Dr. Roda. For me, this scenario is very long scenario because the scenario wasn't mentioned about the SLE explanation. However, Dr. Abdullah asked you that he doesn't know about the disease as a father, so it takes long to explain the SLE. I think in the exam it will be either steroid or counsel about the disease itself. But to be both, it's so difficult to manage the time with both explanation. So what I think it will be either this or this, not both. Anyway, I think Dr. Roda covered most of the side effects, but still, yeah, she missed the bone osteoporosis, she missed the GI upset or peptic ulcer risk. I think because of the shortage of the time. Plus, the social support and the smoking alcohol supposed to be also counseled about. But again, it was related to the explanation of SLE, which is a hidden agenda in this scenario.
I
And I
have
can, yeah, yes, sure.
complete after I forgot
Yeah,
a
yeah,
very important point.
okay.
Yeah, pregnancy. Pregnancy. The best answer is that in pregnancy,
Woman doctor.
all autoimmune conditions will be improved, and
No,
so that.
it will be worse, not improve. SLE will be worse with pregnancy, not the opposite. You got my
I
point?
think
The
it
MS,
will.
multiple sclerosis is the one
Mhm.
improved with pregnancy. But
So,
SLE,
mhm.
it's worse.
Well,
Okay.
okay.
So the best answer in this concern is to include the woman doctor, and it will be safe and planned pregnancy rather than unplanned
Mm,
one. This is the best answer. So
yeah, yeah,
yeah, to answer her concern or his concern about the pregnancy or any patient
yes.
concern for the pregnancy, to involve the woman doctor
Um,
and to be planned pregnancy in order to
Planned
be
pregnancy.
safe one and with good outcome and good baby birth. Okay, this
Yes,
is
yes,
for
yes, yes, yes.
the pregnancy. Yeah, I'm sure Dr. Abdul about the autoimmune. condition,
Yeah,
it
yeah,
worse
yeah.
with pregnancy.
Okay, okay, okay.
Okay, for the MS only it can improve, and even after pregnancy, it will be relapse after the delivery.
Mm.
Yes, as Dr. Marda said,
But
SLE worse in
in
pregnancy.
MS, we
Yes,
will do the same explanation, like the same sentence is better to avoid to be diplomatic, even in MS.
in MS again, yes,
Yeah.
in order, yes, I you can say that in fact the pregnancy or the symptoms will improve with pregnancy. However, we will include the woman doctor also to be following you and to be sure that everything will be fine with pregnancy and after pregnancy. Always
Yeah.
show the examiner that you are talking about the care and the follow-up, not only meanwhile and the current time, no, for even the future. As Dr. Rhoda said, and as Dr. Rhoda did, she was reassuring, although the complication and the side effect of SLE and the prognosis of SLE, but still she is
Mm,
trying to reassure the father for the follow-up and the team and the prevention of the complication. So the best way is to do that. However, there
mm,
is complication, but we will do our best to prevent. We will put our eye on your
mm, mm, mm.
daughter. We will follow her. We will give her appointment in outpatient clinic to prevent and to catch any complication before happen, like high blood sugar, blood pressure and blood sugar, or any other complication might happen in the future.
Mm.
For me, if I will give a score for Dr. Roda, I think she covered the most important
Most
things.
of it.
Yeah, and it was, yeah, as you said, sympathetic and empathetic too much with the father, and she showed the father that we are taking care of her daughter.
Yeah, yeah,
I think, yeah, the introduction also was great by asking the father if he's the next of kin for her,
yeah, yeah,
and
yeah. She
the
did.
idea about the disease, any expectation. Yeah, I
Yeah.
believe the question for any idea about what's happening is good also question just
Mm,
to yeah, to get feedback from the father, any idea about the daughter condition. Then the
yeah.
explanation, because the question for do you know anything and do you want me to explain? Yes, this is also preferred question and preferred way to talk with the father or with the after the introduction. You want me to explain or no? If he said no, great. If he said yes, sorry, if he said yes, great. Uh, you can explain. If he said no, I don't want, much great, and you will go further for the next step, which is the steroid. And the steroid, of
Yeah.
course, will take the main bulk of the scenario. The side
Mm,
effect, the indication, the dosage, the oral, the route, oral or IV, of course, it will be oral, but you will explain all these things and the red flag, as Dr. Roda did, safety netting, and the
safety netting.
medication.
Yeah.
Yeah, medication will be given with the steroid like omeprazole or protection for the gut or stomach,
But
along
we
with
need safety
calcium
netting
and vitamin D.
of the SLE also. Like
Of
if she
course.
developed a change in the urine color, if she developed worsening of
Okay,
symptoms.
the one who
Yeah.
will do that will be hero. Really, he can cover the SLE red flag and the steroid red flag, and it's so difficult to cover both. So for me,
Okay.
yeah, either to remember steroid as red
Mm,
flag of steroid, because also safety netting of steroid, don't stop steroid. She mentioned don't stop steroid
yes. Yeah.
abruptly. It will lead to certain complication. And
Mm,
also the steroid as side effects like infection, it might happen. So if you feel fever or your daughter feel fever or sore throat or any sign or alarming sign for infection, she must
yes.
seek medical advice. So also this is very important. Of course, the
Yes.
SLE, I think the SLE as SLE for the red flag and for the explanation will be another meeting and another scenario to explain and to counsel
Mm,
about SLE. But I think this scenario was target or pointing to the steroid itself. So what you will do, it will be all around the steroid. whatever the indication, the route of ingestion, and the dosage, frequency, the alarming, the side effect, the association the medication will be given with, then the social and the alcohol and the smoking and the job, uh, some red flag about, yeah, the medication. And as you said, if you have time, you can give also red flag about SLE as worsening or alarming signs and symptoms. In general,
Yeah.
Dr. Rhoda did great, yes, and she was too much confident. So I think, yeah, it was good performance from Dr. Rhoda. Thank you, Dr. Abdullah, for the scenario, and well done,
Thank
Dr.
you.
Rhoda. Let's have any question. Okay, Dr. Rhoda give you the scenario on the chat box.
Yes, sure.
Miss,
Oh, she gave? Okay.
yeah, Miss Sarah Robinson from 32 years with complaint of right side weakness and vision problem. Investigation done, including LP, MRI, highly suggestive of MS. Discuss with him and address his concern.
The same.
You
Yeah.
mean,
Okay.
yeah, yeah, but I think this is discuss with her. You will sit with her, right? Role you are
Yes,
SHO
yes,
in the
tell you
neurology
discuss
clinic.
with her. Yeah.
No problem. So you will sit with her, yes. Okay. 2 minutes, Dr. Abdullah, then we will start. We can, yeah, we can call this patient name as Robinson, Miss Robinson, okay? Yeah, she's Sarah Robinson, but let's call her as Robinson because we have our colleague, Dr. Sarah, in the meeting, so we don't want to be,
Okay. Yeah.
okay. Yeah, just call her as Robinson, and Dr. Rhoda
Robinson. Yeah.
will, okay, yeah. 2 minutes, then we'll.
دكتور باسم question
Yeah, sure,
في
sure,
last
sure, Doctor.
في ال previous scenario
Sure, Dr.
this
Sarah.
this patient uh, the one who is talking about her father I think and she is married
Yes,
already صح؟
yes,
طيب who
yes,
is the
yes.
next of kin ولا ممكن زول يكون عنده أكثر من next of kin يعني
No, no. Why not? If he presented to you, so mostly he's next of kin.
يعني her father or her husband or her brother
No, how do you know? Maybe the father, he's the one next of kin. Maybe the husband is living
لا
away,
I
or
mean I mean يعني one person can have a lot of next of kin
yes, it's okay. You can be like this, and can be the more next of kin for her and more close to her, the father. So
it's
he is the
okay
one came to you. Yeah.
to
So
care
whenever,
طيب
yeah, yes,
no need to tell
uh,
that I need to take a permission
you assume that you have permission. Don't tell
uh-huh.
or don't ask as a permission. You will
Yes
assume that, as Dr. Roda did. I assume that we got permission from Mrs. Uh, X to talk about her condition,
about
for
his
example,
condition okay
or
thank
his
you
condition. Yes. And
thank
by
you
the way, next of kin, as the relative sit with you, consider him next of kin, whatever his relationship to the patient, maybe
uh,
even fa- far away.
it is not a blood relationship صح
Yes, at
yes okay
all. Okay, he
okay
might be his neighbor and he will be next of kin. So
صح
mostly,
صح
once he's sitting with you and he's addressing the concern and taking care of her, consider him as
he's
next
next of
of kin.
kin no
Yes,
thank you thank you
most welcome to say. So Abdullah, ready?
Yes, okay.
Okay, just reminding you that this suggestive of MS. So the LP and the
Yeah,
MRI. Okay. Yeah. So I will adjust the timer, then you can start.
yeah, let's start.
Okay. Here you go.
Hello, my name is Dr. Mullah. I am a medical senior house officer in the nerve clinic. Am I speaking with Miss Robinson, 32-year-old?
Yes, doctor. Hello.
Miss Robinson, nice to meet you.
Thank you.
Uh, actually, I am here to discuss with you about your medical condition and address your concerns. Could
Thank you
you
so
tell
much.
me? Could you tell me what do you know so far?
Yeah, doctor. Actually, doctor, recently for the last 6 months, I have like an attack of a problem with my vision and sometimes weakness in my right side of my body. And the GP advised me to see a nerve doctor. And then they did like they took a sample from my back, um, and also they did a scan for my brain, and I'm here to know the result.
Okay, okay, Ms. Robinson, I appreciate your knowledge highly. And actually, the results of this workup is with me right now.
Oh,
Um,
great, doctor.
yeah, and I'm really sorry to tell you that they are not as we hope. They
Oh
are,
my God. What do you mean, doctor? It is not as we hope. Is it like something needs
actually,
surgery? Because I'm afraid of surgeries.
it's actually it's actually highly suggestive of some condition called multiple sclerosis. Uh, did you
What do
hear
you mean,
about
doctor?
that?
No, 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 no. I have no idea.
Um, I'm really sorry that to tell you this is a serious condition.
Oh
Um,
my God, doctor.
this, yeah,
Explain it.
it's a
Mhm.
condition in that lead to soreness in the brain and the main cable of the carrying the cables in the back,
Mhm.
and it leads to such symptoms of when this soreness happens. It's comes in episodes, and
Mhm.
these episodes lead to either complete resolve or get to damage with time of the brain and the main
Mhm.
cable on the back, and
Mhm.
they lead to symptoms of affecting the nerves, the cables from the
Oh my God,
eyes leading.
this is
Yeah,
a really bad news, doctor.
I'm, I'm,
It
I'm,
is a
I'm,
really bad.
I'm,
Am
I'm,
I going to
I'm,
end up in a wheelchair, doctor?
I'm really sorry. I appreciate your question. I'm really sorry that I'm the one telling you this news today. I'm
Hmm.
terribly sorry, Mr. Robinson. And answering your question, um, it's a condition that is variable from person to person, and it's has types actually.
Mhm.
We are not sure of the one that is highly suggested in your case. We need to we need to
Mhm.
run a meeting with the nerve doctor first, and we discuss whether to later on to confirm and to see if there's any alternative condition or that, or if you have this condition itself. You okay with me?
If I have this condition, am I going to end up in a wheelchair, doctor?
It's actually a quite genuine question, and there are a percentage of people, yes, affected that even with treatment, they may develop to a complication and being on a reduced mobility. But we are doing our best. We will involve as a team. We will act. We surely will involve including the consultant, the medical team, and the physical therapy that's for you to help you mobilize your side, and that's affected. Are you following me? And will involve
Yeah.
also the occupational therapy to help you if
So,
this
so, so,
regards.
doctor, so, doctor, is it like curable?
It's not a curable condition. I'm really sorry to tell you that, but it's manageable. We manageable with the team approach. We will include the occupational therapy, the treatment. There are treatments that to act right now and to reduce the symptoms that you have, and there are other treatments that we're gonna give to prevent further episodes. So as it comes in, yeah.
So, doctor, is this treatment will gonna be on a long term?
Right now, we will give something called steroids in the shortest term possible to control your symptoms. It leads to reduced soreness, affecting the damage and affecting the attack, the cables, and they will reduce the soreness that's attacking your brain and the main cable in the back and your eyes. So yeah,
It's like it's gonna be on a long term, doctor.
More likely it will not be on the long term because we will give something now for the controlling of the acute attack, and later on we will give something to prevent further episodes. But that depends on the meeting we will do. We will discuss about your case and to see how much you are responding with our treatment right now. When we give we will give injections in your blood channels, steroids. Yeah.
Doctor, I understand. Okay. So, doctor, actually, doctor, I'm planning to become pregnant. I'm taking folic acid, just preparing for baby.
Yeah. Best
So,
of luck.
doctor,
Yeah.
is this disease will affect my future baby?
Best of luck. Well, actually, the problem is that this condition is quite serious, as I told you. But it's better to arrange a meeting with a with a woman doctor before getting pregnant.
It's all right, doctor. I will involve the woman doctor. It's a great idea. But what about my future female? Does
Yeah.
they will gonna
So
this disease?
So yeah. So there is actually, it's not of the confirmed conditions that are carried by offspring. By I mean your family offspring, but it's one of the conditions that if you have it, that lead to a risk to carrying it to them. So
you mean they have
yes.
like a higher probability than others to get it?
Yes.
So, doctor, I'm a staff nurse.
Yeah.
Does this disease will affect my job?
Well, yeah, I'm really sorry that you may need to involve. We will involve the occupational therapy, and she will discuss. Or he or the occupational therapy will discuss with you about your job. That may affect your job. That may
Oh my
affect your
God,
possible job on the long run. Yeah, I'm really sorry. That's quite for your best.
So
because
when you are going to write this letter?
as sooner as possible. As sooner as possible.
So doctor, I am also,
Yeah.
I think also I'm driving, doctor. Does this disease also affect
No,
my
it's
driving
better not
ability?
to drive.
But
It's
you know, I feel
better.
good now, doctor. I feel very good now. They give me a medication
It's
and everything, and
it's
now I have no vision problem and I have no weakness.
it's
I'm
better
feel good
not
on my
to
foot.
drive. It's better not to drive until we recheck on your condition after giving you treatment. If you have the same symptoms in your eye, and according to that, we will reassess if you are suitable for driving or not.
All right, doctor.
Okay. And it's
All right.
better to avoid smoking and reduce alcohol. Is that all right?
Sure, doctor.
Okay. Uh,
Okay. Yeah. Sorry, time is up. I forgot to remind you 2 minutes before ending. The time is
because
up.
okay,
Yeah.
okay, your comment first,
I'm so
Dr.
sorry.
Zain.
Okay. Sorry for not reminding you. So let's hear the comment from Dr. Zain, Dr. Roda,
Yeah.
then we will comment. Thank
Yes. Actually, this scenario done yesterday by Dr. Salah. The same scenario. You did well. Few comment, like in the introduction, you haven't asked to invite
The
anyone to
idea.
attend the meeting. You
Oh
haven't asked
yeah.
her about the expectation. You give her like a little time for the warning shot, for the warning silence, not a long time.
Mm,
Excellent that you told her it is highly suggestive, not yet like confirmed. You haven't told her about the pathology, like you tell her like in a one line, it's a problem in your defense mechanism that mistakenly attack your brain and then main nerve cable in your back, leading to the symptoms that you have. La la la. And then you will tell her like a little bit about the complication. And it's you tell her yes, it is a long term, not curable. You can tell her even in the introduction. Um, Regarding the management, you told her we will include the nerve doctor. You are the nerve doctor, and your team are the nerve doctor. So how you are going to refer her to a nerve doctor? You told her about the steroid. It is not written in the scenario. And regarding her concern, regarding you told her about, I think it is a jargon, this offspring. I don't know if it's jargon or not, but I think so. When she asked about, let's see the concern. Is it curable? Yes. You can, for any like things that is not like a good news. I do really appreciate your concern. I understand your worries. I'm afraid to tell you that first appreciate the concern, then tell her the shock. I'm 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 afraid that it is not curable, but don't worry. We are going to give you like under close treatment, follow up monitoring, and that just to give like the patient a positive idea. When she asked you about the familiar, you answered her concern, but you took time. Yes, you tell her, yeah, as you told, but you took time. When she told you about the job and driving, according to Dr. Salah, he said, yes, this disease, we should not tell her that she should stop her work now. We don't need to include the occupational health worker now, and she shouldn't need to stop the driving now. Why? Because the disease, we know that multiple sclerosis has many types. She told you now, I'm good, I'm great now, I feel fine in myself. So we can tell her, hold on, hold on. You can tell her that this, as you say, this disease has many types. And the treatment composed of like treating the acute attack, and some patients need a treatment to prevent the disease, and this will be on a long term, and for the treatment of the complication. And not any, when she said, does I need the treatment for a long term, appreciate her concern and tell her not all the patient need treatment on a long term. it depends on a certain criteria that we will discuss with you further in the future. But in our medical team, we will not tell her this criteria, but we know if she has like two attack in two previous years. But not all the patient need a treatment on a long term. All right. Then you told about her job and driving. Back to this, the job and driving, you will tell her this. Actually يعني we give you the medication for the acute attack and you are great in yourself and كده. But like in the future, if you have this like again, if you have acute attack, we will make like a reassessment for you. Actually, some people may end in a disability. Some people may recover completely, and some people may have a minor disability. So we'll see if you have a complete recovery, if you have like a minor disability, or you end up with a disability. At this time, we will decide if we are gonna like include the occupational health worker and to include the DVLA. But at this time, no need. What else? Hold on. Yeah, try always when answering the concern, like appreciate your concern. I understand your worry. I imagine how worried you are. I'm really sorry for that. Yes, but you did great. Thank you.
Thank you. Thank you actually for this case. It's a good training. And you acted in the exam like you bombarded me with the concern, didn't give me time, and that's like the exam really.
Yeah, it's
Okay.
done yesterday by
Sure.
Dr. Salah.
Yeah. Sure. Okay, thank you.
Welcome.
Thank you, Dr. Rada, for the case. Well done, Dr. Abdullah. I feel
Thank
you're
you.
more confident than before. Yes, in this
Thank you so
scenario.
much. Thank you.
Yeah. I just advise you don't interrupt the surrogate while he's talking. Let him talk whenever he start to talk.
But
It's
what
like
if this happens? What if this happens in the exam? They said sometimes the surrogate doesn't give you time at all. So it's happening
no,
right now. So if I
yeah,
am silent, I will not be able to.
no. It's not like that. When he talk long only, you can stop him. But if he talk like a concern,
It
a
was long
important
here. No,
question,
it was long here. It was very long here. It was very long here.
anyway,
Yeah.
this is
Because
this.
so the question doesn't take 1 minute, more than 1 minute. Actually, it's happening right now, like that.
So yeah, try to be listener as much as you can, okay, and let him finish the question and answer him quickly. If he's talking more, you can stop him for the social, for something you didn't finish, like the task itself. But
Sure.
be sure that he has the right to talk and to ask you, and he had the right to answer and to address his concern. So what you have to do is to be listener as much as you can, unless you didn't finish your task, you didn't ask about social work or social issues. That time only you can stop him if he's talking more than enough. This is a general advice. Believe me, it's written for feedback for a lot of colleagues that good or positive feedback. He's good listener, and as well as for the negative feedback, he's not listening to the surrogate. So both comment will come. If you are good, you will be good and good listener, and if you didn't, it will come in the negative feedback that you are not giving him time to talk and you are kept talking all the scenario. So as much as you can be listener, and as much as you can keep asking his understanding. Don't talk longer to understand what he got from your words. Okay, this is also general.
Sure.
But in general,
Thank
the
you.
scenario you drive the scenario well from the introduction through the expectation only you can ask, and the golden silence here, and the way for delivering the bad news, you did it great. Then yeah, the reassurance also is good in this scenario. Especially, it's all this suggestive, still suggestive. So the best way is to do like what you did, just to tell him this is suggestive, and to talk about the multiple sclerosis. If he said like it's definite and it's final diagnosis, you can tell him, no, we have to run further investigation, as you did, further investigation to confirm the type and to confirm the diagnosis and to sit with the consultant instead of saying the nerve doctor, because you are the nerve doctor. So as Dr. Roda said, you are the one primary here. The best alternative way is to say, I will let you sit with my consultant or my senior to address your concern or to give you the possible management plan if you are not sure about the plan. Especially the steroid, as Dr. Roda said, it's not written there. So you can give like diplomatic answer. We have our management plan by our professional team that we will give you the best interest of your condition according to the type of your disease. Don't give any medication as long as not mentioned in the scenario. Okay, and this is also general advice. So I'm not talking just for you. Yeah, I'm talking in general. Try to be diplomatic in all answer and stick to the scenario and read the scenario well. Always the mentors advising to read the scenario many times because every word in the scenario means something, and every word is not written also means don't mention. So don't mention something not written, and if something written means it means something you should do, either to mention or to touch or to explore or to ask about. This is the advice regarding the scenario and the word in the scenario. Okay. Apart from this, you drive the scenario well, as Dr. Oda said. I think, yeah, this time much better than previous scenarios, Dr. Abdullah. If you have any question or comment.
Thank you so much. I appreciate it. Yes, yes, yes. You are right. Thank you so much.
Yeah, okay, well done. The issue also for driving, and this is also I hear from Dr. Oda, driving for me, if I will be in this scenario, I will talk about the driving and uh, to stop driving temporary until confirm your type of diagnosis or of the disease and to the, according to the disease itself because it's still suggestive. But I will stop here definitely because there is possibility. If you have 1% possibility that it will harm here, you should do it. I don't
You
know,
know,
Dr. Roda may be against me, but I will do that. I will
you
stop
know,
here. Yes.
it's yesterday done by Dr. Salah Azad, and
Yes, I know.
the candidate told the patient to stop driving and to stop driving, and we will write letter to occupational health worker. He said no. The patient now is good in himself, and this depends on the assessment of the patient after the acute attack, because some patient may make complete recovery, some may end in a minor disability, and some may have a like a major disability. So right now, no need like for the DVLA, no need to stop driving, and no need to write a letter for the occupational health worker. But you need to tell him that in case that you have like tell the patient in case that in future you have another like acute attack and you end up with a disability that might affect your ability to work or drive, in that case we will write a letter to your occupational health worker, and you might be needed to relocate you to office job, and you might need to stop driving and involve the DVLA, and I'm gonna write all these in my document. Is that okay, Mrs. Sarah Robinson? Yes, okay. Thank you. That is exactly what's said by Dr. Salah yesterday.
Yeah, I appreciate Dr. Roda what any mentor saying, and be sure that some mentors are not examiner. So
Yeah.
I don't know how he can judge and how the examiner will judge on that. You might say that, and what you will tell him, this is by some mentor. I'm not sure, but for me, I believe that. If something have risk for the patient, even 1%, be safe for the welfare to advise him to stop driving if you feel the disease will affect his driving. This is my opinion also. I'm not mentor to say, yeah, no, you don't have to do that and you have to
Yeah.
do that.
Yeah.
So yeah, everyone can advise, but which one you can follow? I
Yes.
think I will follow my sense. What is my sense in this scenario? If I feel that the patient has a risk, if he drive and he might have attack of optic neuritis and he will have accident and it will be against me, no, I will tell him, no, please stop till further assessment. I will not tell him stop permanently or forever. This is my humble opinion. If someone can follow doctor or it's optional. You want to follow. I'm talking about something like sense. Follow your sense, not mentor sense, because
Yeah,
the mentor is not
actually,
with
I
you in the
agree with
exam.
you, especially with the point of driving. I totally agree with you.
No, I'm talking. Yeah, I'm talking about driving. I'm not talking about occupational
Yeah,
health
but
or occupational.
I'm just
Yeah.
transferring what he said exactly.
Yes, yes, I know, I
Yeah.
know, but I think it doesn't make sense for me that because of he is fine now, I will not stop him driving. Okay, maybe he will get out from my clinic and he will have any relapse and he will have any accident and he will be like in trouble and it will be, isn't? So this is my opinion. Again, I'm just saying follow your sense. The mentor, yes, they are doing their best to help us how to do and how to deal, but they are not examiner. We don't know how the examiner will understand my
Yeah,
expression to this
right.
patient.
Yes, right.
So yeah, again, it's opinion, and you can follow any. But what I can say, follow your sense in the scenario, in the field itself, in the scenario, or on the time of the exam. Maybe you will feel this this hidden agenda. It will be include something you should warn about. Maybe you feel that in while the surrogate talking, so you can do that. So according to the instant of exam, try to follow your sense in the exam. Don't remember mentor or because you don't know the examiner how he will judge you. Again, this is my humble advice. Everyone can follow or just ignore.
Dr.
Okay?
Basim,
Yes,
to be
sure.
honest,
Mhm.
yesterday Dr. Salah mentioned a lot of يعني odd information. Also, he said that this disease is not familial. And also, he mentioned that MS is not an autoimmune disease. It is just inflammation in the myelin sheath. And so,
No, no.
so I don't
When
know
he
what
said,
to tell.
I think when he said soreness, he said like inflammation, but for the sake of time, he haven't said for the defense mechanism. But of course, he will say. And regarding the familial, yes, there is no like autosomal dominant and recessive in the myelin.
Yes,
He mean like people or the
but
children will have higher probability than others. But his idea is great.
But when explained to the patient, we told him, yes, it's familial disease, running families and not by
He
a
said
certain
it's
mode
not
of
It's not
familial.
inheritance,
genetic. Yeah,
not
it's not
genetic,
genetic
yes,
one,
لكن
but
familial
it can, yeah, it can run in family by
families, yes.
yeah, another factors, not genetic, but other
Not
factors.
genetic,
Yeah,
no specific mode of inheritance, but it's
yes,
a familial
exactly.
disease.
But still, it can run
And
in
also
family.
he said
So
it is not an autoimmune. He said like this, Dr. Aruda. He said it's not an autoimmune. It's just inflammation, and there is no proven that it is
so
autoimmune.
I believe it's autoimmune and it's an unknown theory, but still, it's like the body attack the nerve cable and the brain,
Yes,
isn't?
yes,
And
yes.
So
and
again,
and
I don't
actually
know.
I was the candidate in this scenario yesterday with Dr. Salah. And regarding for the soreness and inflammation, just for the sake of the time, he said soreness and inflammation, but he doesn't say in his mouth that it is not like an autoimmune. And regarding the familiar, I think in communication scenario, when we say familiar, when we say familiar, we mean autosomal dominant recessive, X-linked recessive. Yes, it is not familial.
Exactly.
But
This is
yeah, but the
familial,
offspring
not
has
in.
like high probability than other to get it.
Yes, exactly. Yes. By the way, offspring
Yeah.
is not jargon, Dr. Ruda. Offspring is not jargon. Okay? Because you mentioned it's like jargon, but it's not jargon. Offspring and siblings and family members, it's like something in the realm, so it's not a medical word. Anyway, always the hot discussion make the information more clear and fixed. I think now the scenario is clear for us and how to do so. Okay, let's read the comments. Any question, any comment actually may develop soon vision problem while she is driving. Yeah, this is my opinion. Better to be in safe side. This is also my opinion. In case if we ask about driving and the patient is free from symptom, now no need for stopping. Okay, free of symptom when he is cured one, but this is not cured disease. It's like relapsing disease. So how do you know? How guarantee you have if the patient now okay and he will have the condition again? No one has any guarantee for that. Of unknown origin, yes, but it's considered one of the defense system. I agree also with you. It's not familial, but it's in the family more than other to be have. Yes, exactly. So it's not genetic or not familial. Genetic is jargon. So the best way to explain genetic to say it's familiar, runs in family, but without rule. It's depend on multi-factors, and your kids will have the risk or higher risk than normal population because you have the disease. That's it. But it's not genetic or not familial to be running in a rule or a model of transmission through the genes or the
Just like
codes, if you
diabetes,
will.
I think.
Yes, yes, like diabetes, yes. Okay. Thank you for the discussion. And thank you for both scenarios. Both are related, multiple sclerosis and SLE. Thank you, Dr. Abdullah, Dr. Huda. Any questions? Any comments before ending the session? Okay, thank you all again. Thank you, Dr. Huda, Dr. Abdullah. Yeah, thank you. We'll see you tomorrow. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.